Hi friends, welcome to Smile Nursing tutorial. Last we have discussed about the active management of third stage of labor. Today we are going to speak about the administration of magnesium sulphate. It is also termed as MgSO4, which is very important to treatment for pre-eclampsia and eclampsia. Next, availability of the medicine. Injection magnesium sulphate, 1 ampoule has 2 ml and 1 gram of 50% strength MgSO4. As per the WHO recommendation for to prevent and treatment for pre-eclampsia and eclampsia. Magnesium sulphate 50% of injection is a medicine used in treatment of decreased magnesium levels in blood. It is also used for treatment of seizures in pregnant women who have high blood pressure. It widens the blood vessels, the brain, and improve the blood supply to the nerve cells. Next, we are going to see the full loading dose of magnesium sulphate. First, using a 20 ml syringe, draw 80 ml, that means 4 gram of MgSO4, 50%. Add 12 ml sterile water or saline to the same syringe to make a 20% of solution. Next, give slowly IV over 10 to 20 minutes, followed by 10 ml, that means 5 gram of 50% magnesium sulphate to be given in each buttock deep IM. Actually, total 10 gram deep IM should be given. Now we have discussed the full loading dose of magnesium sulphate. Next, coming to the maintenance dose, 10 ml, that means 5 gram of 50% magnesium sulphate in alternate buttocks. Fourth hourly for 24 hours from last convulsions or delivery, whichever is later. After that, we have to continue ringer lactate at the rate of 60 ml per hour should be given. Next, coming to the pre-referral dose. For facilities where full loading dose cannot be given, at the time we should give at least 10 ml, that means 5 gram of 50% magnesium sulphate to be given each buttock deep IM. Meanwhile, the patient ideally reach first referral unit within 2 hours. To give 4 ml, that is 2 gram of 50% magnesium sulphate with 6 ml of distilled water or normal saline. Give slowly IV over 5 to 10 minutes. Okay. Next, we can administer the 2 gram IV dose only once. Sometimes patient may get uncontrolled fits. At the time, what should we have to give? See, these uncontrolled convulsions, we have to give injection diazepam 5 to 10 mg IV start. After that, may be repeated every 10 to 15 minutes up to maximum dose of 30 mg. Coming to the sign of magnesium sulphate toxicity, urine output drops to less than 25 to 30 ml per hour. Absent knee jerk. Respiratory rate drops to less than 60 per minute. In case of any toxicity, we have to skip next maintenance dose. Give injection calcium gluconate 10 ml over 10 minutes in case of respiratory depression is seen. There may be some reaction to the drugs. Okay, we have to see signs of reaction to injections. First, blister formation if not given deep IM. Warmth, thirst, headache, nausea or vomiting. Nursing care, it is very important. Put mouth gag and perform suction to clear airway. After that, start oxygen at 6 to 8 liters per minute. Start ringer lactate at 60 ml per hour. Next, Hollis catheterization should be done. We have to mention time and dose of injection magnesium sulphate on referral slip. If referring out, patient should ideally reach first referral unit within 2 hours. Next, calcium supplementation helps in prevention of preeclampsia or eclampsia. 2 calcium tablets each containing 500 mg, that is elemental calcium, and 250 international unit vitamin D3 to all pregnant women for 6 months during the ANC period after first trimester and for 6 months during lactation should be given. Discussed about the administration of magnesium sulphate, full loading dose, next maintenance dose, pre-referral dose in recurrent fits, uncontrolled convulsions, in case of any toxicity, signs of reaction to injection, on nursing care. Today we have discussed all above topics. Next we will meet with breastfeeding. Thank you for watching this video. Please like, share and subscribe.